The G-spot has been a topic of intense discussion for decades, often framed as a mysterious, almost mythical button for female pleasure. This ongoing debate isn't just about semantics, it speaks to a much larger historical issue of how we understand, or honestly fail to understand, female anatomy and sexuality. For too long, women's bodies have been shrouded in mystery and misinformation, and the conversation around the G-spot is a perfect example. The quest to label it as either a myth or a marvel often misses the more nuanced and medically accurate truth. Understanding its history is the first step in dismantling the confusion and empowering people with facts, not fiction, about their own bodies and their capacity for pleasure. The term G-spot was popularized in 1982 by Alice Kahn Ladas, Beverly Whipple, and John D. Perry in their book, The G-spot and Other Recent Discoveries About Human Sexuality. They named it after Ernst Grafenberg, a German gynecologist who in the 1950s described a sensitive zone on the anterior, or front wall of the vagina. Grafenberg noted that stimulation of this area could lead to a distinct type of orgasm, and sometimes the expulsion of fluid. However, his research was largely overlooked at the time, buried in a medical landscape that had little interest in exploring the complexities of female sexual response beyond its role in procreation. The concept didn't gain mainstream traction until decades later. The controversy ignited almost immediately upon the book's publication. Critics, including many within the medical community, argued that there was no definitive anatomical structure that could be universally identified as the G-spot. The inability to point to a single, discrete organ on a cadaver or an ultrasound led many to dismiss the entire concept as pseudoscience. This skepticism was fueled by the fact that not all women reported experiencing heightened sensitivity in that specific area. The resulting debate created a harmful dichotomy. Either the G-spot was real, and women who couldn't find it were somehow deficient, or it was a complete fabrication, invalidating the experiences of those who did find it intensely pleasurable. This historical back-and-forth highlights a fundamental misunderstanding of female anatomy. The search for a single isolated spot was flawed from the beginning. Female sexual anatomy is not a simple switchboard of buttons, but a complex interconnected network of tissues, nerves, and blood vessels. The controversy arose because the conversation was framed incorrectly. It wasn't about discovering a new, magical organ. Instead, it was about finally acknowledging a specific region of a much larger, dynamic system that had been ignored by medical science for far too long. The focus should never have been on a single spot, but on the entire clitoral-vaginal complex. So, what and where is this area we call the G-spot? It is not a distinct, standalone organ like the clitoris or the uterus. Instead, it refers to a specific region located on the front wall of the vagina, approximately 2 to 3 inches inside from the vaginal opening, behind the pubic bone. Anatomically, this area corresponds to the part of the urethra that is surrounded by spongy tissue and the internal parts of the clitoris. When not aroused, this tissue can feel slightly different from the surrounding vaginal walls, perhaps a bit more textured or ridged. It is not something you can see, but rather something that can be located through touch and internal sensation. To understand this region, we must move beyond the idea of a spot and embrace the concept of the clitoral-vaginal, or CUV, complex. This term accurately describes the intricate network of structures that work together to produce sexual arousal and orgasm. The clitoris, for example, is far more than the small external nub visible on the vulva. It has extensive internal roots, or legs, called crura, that extend downwards and backwards, wrapping around the vagina. The tissue of the G-spot area is in close proximity to these internal parts of the clitoris, as well as the urethra and Skene's glands, which are sometimes called the female prostate. It is this intersection of sensitive tissues that creates the pleasurable sensations. Think of it like this: the G-spot is less of a destination and more of a busy intersection. When this area is stimulated, pressure is applied not just to the vaginal wall, but also to the underlying urethra and the internal structures of the clitoris. This is why many women report that G-spot stimulation feels different from external clitoral stimulation. It involves a deeper, more diffuse pressure, and engages a different combination of nerves and erectile tissues. The sensation is a product of the entire anatomical neighborhood being activated, not just one magical spot on a map. This is a crucial distinction that helps us move away from a simplistic and often frustrating search for a single point. The lack of a single identifiable anatomical entity called the G-spot is why it has been so difficult to prove its existence in a way that satisfies traditional anatomical standards. You can't dissect it out and put it in a jar, but that doesn't invalidate the experience of pleasure. We don't question the existence of the funny bone, even though it's not a bone at all but the ulnar nerve. Similarly, the G-spot is a functional zone, a place where a combination of structures creates a specific sensory experience. Recognizing it as a complex of tissues, rather than a single spot, is the key to understanding its role in sexual pleasure. When the G-spot area is stimulated, the erectile tissue within the covey complex begins to swell with blood. This process is similar to how the external clitoris or a penis becomes engorged during arousal. For many women, this swelling can create a sensation of fullness and a need to urinate, which is perfectly normal given the area's close proximity to the urethra and bladder. As stimulation continues, this initial sensation often transforms into a deep, intense pleasure. The type of stimulation that works best varies from person to person. Some may prefer firm, consistent pressure, while others respond to a come-hither motion with the fingers. There is no universal technique. One of the most discussed and often misunderstood phenomena associated with G-spot stimulation is female ejaculation. This is the expulsion of fluid from the urethra during orgasm. For centuries, this was either ignored, misidentified as urinary incontinence, or sensationalized. We now understand that this fluid is not urine. It is produced by the Skene's glands, which are located along the urethra and are part of the G-spot complex. During intense arousal, these glands can produce a clear or milky fluid, which is then expelled during the contractions of orgasm. The amount can vary from a few drops to a more significant gush. It is critically important to state that not every woman will experience female ejaculation, and it is not a requirement for a pleasurable or successful orgasm. Like all aspects of sexual response, this is a normal variation. Some women ejaculate with every orgasm, some only with a specific type of stimulation, and many never do. The pressure to achieve this can create anxiety and detract from pleasure. The goal of sex should be pleasure and connection, not performance or hitting a specific biological checkpoint. Female ejaculation is simply one possible outcome of arousal for some people, not a universal standard of female sexual function. Ultimately, the sensations derived from this area are subjective and unique to each individual. Some people find direct stimulation of the G-spot area intensely pleasurable, leading to powerful orgasms. For others, it might feel uncomfortable, or they may feel nothing at all. This is not a sign of dysfunction. Our bodies are all built slightly differently, and our nerve distributions vary. What one person finds pleasurable, another may not. The beauty of human sexuality lies in its diversity. The existence of the G-spot as a potential pleasure zone simply adds another dimension to the vast landscape of female sexual experience. The conversation around the G-spot is plagued by myths that can cause confusion and anxiety. A common myth is that all women have a G-spot and should be able to achieve a vaginal orgasm through its stimulation. This is false. As we've discussed, the G-spot is an area, not a universal button, and sensitivity varies widely. The fact is, most women require external clitoral stimulation to reach orgasm. The pressure to achieve a purely vaginal orgasm is a harmful remnant of Freudian psychology that has no basis in modern anatomy. An orgasm is an orgasm, regardless of how it's achieved. Another persistent myth is that female ejaculation is the same as urinary incontinence. This is factually incorrect and can cause significant shame and distress. Studies have analyzed the fluid from female ejaculation and found that while it may contain trace amounts of urea, as the fluid passes through the urethra, its chemical composition is different from urine. It is chemically similar to fluid from the male prostate, which makes sense as the Skene's glands are developmentally homologous to the male prostate. Understanding this difference is crucial for normalizing the experience and reassuring women that this is a natural sexual response, not a medical problem. A urologist's perspective helps clarify the G-spot not as a single entity, but as an anatomical intersection where different systems converge. From a urological standpoint, this region is where the urinary tract and the sexual response system are intimately linked. Understanding this connection is vital for both pleasure and health. For instance, pain in this area could be related to a urinary tract issue, while certain sensations of pleasure are directly linked to the engorgement of urethral and periurethral tissues. Acknowledging this complex interplay allows for a more holistic view of female pelvic health, where sexual function and urinary function are not seen as separate but as interconnected. In conclusion, the G-spot is very real, but not in the way it's often portrayed. It is not a mythical button but a complex, sensitive region, the CUV complex, that for many is a source of profound pleasure. The most important takeaway is that there is no right way to feel pleasure. Every body is different, and what matters is understanding your own anatomy and what feels good to you. Open, honest conversations with partners and healthcare providers, free from shame and misinformation, are the best tools we have. By replacing myth with medical fact, we can empower everyone to embrace their sexuality with confidence and knowledge.